The one who posited the idea that there may be such a thing as movement of the cranial bones. And that was quite a courageous proposition way back in those days. And indeed, it is still challenged to this very day in a number of quarters. The story went, of course, that Sutherland was one day in the office of Still. He looked at the bones of the head, and here let me introduce one. Here we have Henry, a real skull, and you can see these are effectively the joints of the different bones of the head. And he looked at these bones and thought, we've got the zigzag pattern, you can see that there. The zigzag pattern of the joints of the bones. And he thought, those beveled articulations there provide for movement, surely. In other words, what he was seeing was a very possibility of something where the joints meet, something going like this type of thing. Anyway, Sutherland worked on this for quite a long time, worked on his patients, worked on his family, and decided this was a very decided road to go. As far as he was concerned, he had satisfied himself that there was such a thing as movement. But I have to say, that proposition is still, in a number of quarters, is still not clear yet as to whether there is such a thing as cranial movement. So that, oh, how did he get here? The question is still out there, believe it or not. Do cranial bones move? And I've given a quotation here from Hopkins Hospital Medicine. In normal development, bones that meet at each cranial suture, these are incidentally the sutures, these joints that we've just looked at, they fuse together at different rates that allow for normal expansion of the brain and soft tissue during infancy and childhood. By early adulthood, the fusion of all craniofacial sutures are completed. And what does fusion mean? Fixed, immobile. In the area of conventional medicine, in the area of all textbooks, those sutures, the line of junction or an immovable joint between two bones, especially of the skull. In other words, they are fixed. There is absolutely no movement. And that is the conventional view to this day, that there is no movement whatever of those sutures, and therefore all of the bones of the skull taken together are immovable. Well, they are, of course, in the cadaver, but that's not what we're dealing with. We're dealing with the live person, aren't we? Then we come to this interesting report. This was taken from a report from NASA. Researchers have learned that the bones of the human head move ever so slightly as pressure inside the skull increases. This discovery has a big effect on both astronauts in space and medical patients on the ground. NASA has developed a type of ultrasound method to monitor intracranial, that's the pressure within the head, intracranial pressure by measuring the subtle movements of the skull. Most people think the skull is a rigid container, not least of all in widespread medical circles, of course, that doesn't change in size or volume. It's been shown, however, that the skull moves with changes in intracranial pressure. This movement is so small that it is not even detectable to the human eye. So we have the first indication here from a very reputable source that movement is possible, movement does take place.